Hi, I'm Lauren, and the reason why you probably clicked on this video is because I clickbaited the fuck out of you. Actually, I didn't really, because I have a snapping biceps femoris. What the fuck is that? Let me tell you, a brief anatomy lesson, if I may. The biceps femoris is one of your hamstring muscles. So the tendon is basically the muscle tapers off into a tendon and it attaches to your bone, right? The bone that the biceps femoris attaches to is the fibula. The fibula is your outer shin bone, right? You have the tibia and then the little itty bitty fibula, right? Yeah. When you have a snapping biceps femoris tendon, that means whenever you bend it past a certain angle, for me it's past 90 degrees, the tendon snaps over the bone. I don't know if you guys just know this or whatever, but it's not common at all. And I live in a really, really small town. So I assumed after my GP told me that you'd never seen anything like it, that, maybe the orthopedic surgeon would, like someone who does bone stuff. No, the orthopedic surgeon here is like, I've never seen anything like that before and I'm not operating on you. Fair enough. I wouldn't either if I were an orthopedic surgeon. So then I got referred down to Vancouver. Vancouver, the big ass city, Vancouver, where all the specialist people live, right? And the knee specialist had never seen anything like it before. Which was scary. I went down and he's like, yeah, basically I've never seen anything like this before. And I don't know if it's operatable. He's like, I don't know if I can operate on it. But he ended up doing a little bit of research. None of his coworkers had seen anything like it before. I'm assuming he did what I did and did a little Google search and found 2 or 3 case studies. And found an operation that makes a lot of sense. So we're gonna try it. Basically, we're gonna try it, and hopefully it works. I wanted to make a video because it's not a common surgery, or a common injury for that matter, at all. Maybe one of you guys have this injury or this weird thing and you're like, what the fuck is going on? And since it's not common, there's not a lot of exposure in media or whatever on it, or people to not look up to, but you know what I mean, to have someone who's gone through the same thing. So I am stepping up and being that person for you. So I'm gonna take you guys down with me to Vancouver. I'm gonna get my surgery and all of the fun shebang after that, rehab or physiotherapy, rehabilitation, whatever they call it or whatever they want to call it. It's raining so hard. Man. Today's Friday. And my surgery's on the 25th, which is a Monday. So I'm almost a week away. And I leave in a week. I leave in a week down to Vancouver. We're going on a ferry. I don't think the ferry will be as fun going down as it will be back. I guess that's really all I wanted to say for today or for now. I will see you guys on Thursday, because Thursday is my last day of swim practice. Oh yeah, fuck. A little bit about me. I swim. I'm a swimmer. Since I can't bend my leg past 90 degrees, I can't do breaststroke. I wasn't good at it anyways, and it got me out of the 400 IM. But I can't do it. That's it. I can't work because of it, because it kind of, after I stand for long periods of time or walk for long periods of time, it starts throbbing. Who knew? It just fucking throbs. And I was a lifeguard. And I felt like that my injury might inhibit my abilities to save people or bend down, because when it's sore and everything hurts, So I am currently jobless. Unemployed, if you will. I am a first-year student at UBC Okanagan, and I'm studying human kinetics, which is the body. Super cool. The body is cool. Bones, muscles, other shit that the body does. Amazing. Anyways, I'll see you guys on Friday. Thursday. I'll see you guys on Thursday. Ow, that should be fine. Anyways, I just got home. I just had chiro, and then I went to Shoppers because I had a parcel to pick up. And I'm so excited because I have 3 more practices left, right? 3 more. I leave in 4 days. I ordered swimsuits on Boxing Day, and I was hoping that they'd come last week because I wanted to wear them before I couldn't wear them for like 6 months. They came with 3 days to spare, so I'm gonna open them because I'm so excited and I wanted to share. So they're from Jolyn, which is it's an American website, and they're pretty cool, and I really like their suits, okay? Anyways, so I got 2 swimsuits. I got the Julian one is the green. So the star one is the Scotty Swim onesie. I got fixed back this time because when I'm activating the knot in the tie back, I have one tie back one. The knot, it pokes my back when I do stuff. Anyways, also their tags are stickers, and it's really cute. I believe that this is their breast cancer print for this time. Last year, I got one for Christmas, and it was a pink one, and it was a breast cancer like awareness one. There's a lot more ass than I was expecting. A lot more ass. I guess we'll see. And next one, I'm so excited. It's such a pretty color. Oh fuck. Okay, it's not the Velcro. Be careful. Velcro's bad. I don't know what the fuck this is. Genuinely, is it a dog? Anyways, this one is green, but not only does it have a cool kind of cross back as just like the other one, but it has cute little stripes, and it's a really pretty green. I hope that you guys can see because the lighting in my car is kind of bad, but it's like a really pretty like emerald green and then purple. I love it. I'm so excited. Now I'll see you guys on Thursday. That was a brief intermission because I was really excited and I wanted to show you guys my new swimsuits because I'm so excited. And I get to wear them once and one of them twice before I can't wear anything. Not anything. I will wear clothes, but before I can't wear swimsuits for like 6 months. Who knew that Thursday would come so quickly? This is my last practice. Gonna try not to cry because, well, it's too late. I'm scared. I guess this could be my last practice. I just got to the parking lot. I'm at the pool, and this is my last practice for the next 6 months. Or never, depending how the surgery goes, because I don't know how it will go. I don't even know if it will be successful. And there's a 5% chance that I can just lose control of my foot and it's just flopping, which would be kind of funny, but not fun, you know? Like, I kind of need my foot to be working to swim. I mean, it's not like I'm good at swimming anyways. I just like it, and if I can't swim, what am I gonna do? I just wanted to document this because it's the last practice. Practice sucked. Because I had to stop and I had to do kick because my shoulder hurts. I have a really tight deltoid, which is hot. And also I missed a phone call from the hospital, the one that I'm getting my surgery at. And I don't know what they want because when we tried to phone back, their office was closed. So it's either they canceled it again because I was supposed to get it done on December 14th, but they canceled it. So it's either canceled again, or they were just reminding me to get a COVID test and what the fasting was before my surgery. So hopefully it's that, but if they try phoning tomorrow and it's too late, we're on the ferry and I won't have cell service. So that will be interesting. Yeah, I guess I'll keep you guys updated. Right, good morning. It is Friday, and it is 8:51, 7:51. It's 7:51 right now. In like 50 minutes of my class, and then I'm gonna have to leave. Which is fine because it's linear kinematics. I'm in, this is my biomechanics class. So it's physics, but with all the examples as humans. So, yeah, we're gonna do the class and then we're gonna go head to the ferry. We're on the ferry now. So, yeah, I'm just doing homework. we should be on the island by, I think, 9 a.m. tomorrow. So, yeah. It's pretty. So pretty. And really fucking cold. So I wanted to do a thing where, hey, this is my body before I got surgery, and then I'll do one when I get the okay to like start activities again, and then I'll do another one when I am happy with the way I look again. We are like in the middle of the ocean between Nanaimo and Vancouver. So we spent the night at my brother's in Nanaimo, and now we are on our way to Vancouver. And yeah, today is the last day of me walking properly. I get my surgery tomorrow. It's so soon and I'm so scared. I'm really excited though. It's crazy to think that it's tomorrow. Like it hasn't set in that it's literally tomorrow. Like in less than 24 hours. That's crazy to me. My mom and I are going to go to the mall. Or a mall, just one. Normally it's not really busy at all, and it's the Tawasin Mill Mall. It's an outlet mall, so because we're cheap. Yeah. So that's what I'm doing, and then later tonight I have to do my psychology notes, because I normally do it every Sunday, so gotta get that done. And yeah, I guess I'll see you guys tomorrow morning. Or no, I'll see you guys later tonight because I'm going to be very nice to my surgeon. I'm going to shave my leg. We're in Vancouver. I just showered and I shaved my legs. I'm also on Zoom with my friends. They're doing physics and I'm going to do psychology and then go to bed. So I will see you in the morning. My mom's in the shower, and it is 5. This is the swim hoodie, and these like shorts that like stretch a lot. So I have to be at the hospital by 6, and surgery is at 7:45. I'm so scared. I wasn't able to eat until past 12, but I didn't eat until I didn't eat. I ate breakfast. Not breakfast, what? I ate dinner at like 7, and I didn't eat until then because I don't know, I didn't want to poop myself, I guess. I really have to pee. And I'm also really scared. I'm so scared. It's literally today. Like, it's literally today in like 3 hours. I'm gonna lose movement of my foot. It's very low percentage. It can still happen, but I don't think it will, and I hope it doesn't. I'm so scared, but I'm also so excited. I have so many questions for the doctor, like a little thing that I can check off, and because I'm like double jointed or like flexible enough to do that. And all of like the Dr. Viscontas and our orthopedic surgeon at home and my GP. Actually, I don't think my GP said it. So like the orthopedic surgeon at home and sorry if my hand's shaking. I have 0 arm strength. That's a lie, it's my only strength. The orthopedic surgeon at home and Dr. Viscontas, my surgeon here, said that I have loose connective tissue. So like ligaments and tendons is connective tissue. So are bones. Bones are considered connective tissue. Isn't that crazy? Anyways, loose connective tissue. So my tendons and ligaments are just super stretchy, and they're not supposed to be. It makes me more susceptible to injury, which is probably why my Frank is doing what he's doing. Frank is my Biceps Femoris. I don't know if I mentioned, but that's what I named him. Yeah, I'm scared. It'll be okay though. It'll be okay. All of my friends, my friends are like, it'll be okay, Lauren, you're just, yeah, so I guess I'll see you guys in the hospital. I know I didn't show what Frank did, so this is what Frank did before he got put in his space. Hi. So I just got back into the truck and my mom went to Starbucks to get food and water and coffee. So, this is the brace, and my skin is full orange from cleaning, and it's incredibly itchy. Kind of uncomfortable, honestly, sitting in the truck. Anyways, so the surgery went well. I can still move my foot, which means I still have control of my foot, and then the nerve didn't go to sleep, which is what I wanted because I can still swim now. And then I asked my doctor, Dr. Viscontas, and like, did the snapping stop? And he's like, I think so. So I think that's good. So as far as I know, the surgery was really successful, and it was also really cool because right before I went in, another doctor, he wasn't the doctor, Dr. Viscontas, and he wasn't working in the OR operating on me. He wasn't part of the Viscontas' team. But he came up and he's like, are you Lauren? And I'm like, yes. And he's like, you're the one with the snapping in your knee, right? I'm like, yes, that is me. And then he asked, do you mind if I look at it? I'm like, no, of course not, go to town. Which I thought was pretty cool because obviously it's not a common thing. So he thought that was pretty cool. And I also thought that was pretty cool that like people were interested by it. So yeah, right now my knee feels like how it does when I'd walk on it for long periods of time, so it's kind of throbbing. Granted, the throbbing's a bit deeper, but I think that's because of the anchors in my bone. So yeah. Also, granted, I'm on like a various amount of drugs, and they put a freeze in my leg, so the freeze or like the numbing thing will wear off in like 3 hours. So we'll see we'll see later how that feels. And yeah, I'm not in a lot of pain at the moment, but again, we'll see. And I'm super happy because it went well, and I can still move my foot, which is what I was mostly worried about, because if I can't move my foot, then obviously I can't swim. Yeah, so we're gonna leave Vancouver earlier, and we're gonna go in with my grandparents, which will be nice because my grandparents have seats in their showers, which means I will be able to shower. And I don't know if I mentioned this, but the surgery that they had to get done, they cut open my leg and exposed the bone, and then they put anchors into my bone, and then they sutured the tendon back to where it was supposed to be, or it was rudely taken from 3 years ago. Yeah, I guess I'll probably see you guys like later tonight when I attempt to shower for the first time, because I like being clean, and I like showering once a day. So we will see. I begged my mom to get me a shower chair. Because originally she's like, you can just crawl into the bath and take a bath. I'm like, no. So she finally agreed to let me get a shower chair. So I have a shower chair. I get to try to shower now. So I have my white condom on. And hopefully I don't die. It's almost 9. I just finished showering. I did not fall. So this is what we're working with. My mom, because my leg was orange because they disinfected it, right? And my mom took off the brace so that she could clean off some of it. I'm not allowed to take the like wrap off. But when it just doesn't feel right anymore. Like it feels like this is directly onto where they cut, which it is, but it just hurts. And like earlier today when I was doing notes for psychology, like when the freeze and all the drugs kind of started weird, started not being effective anymore, I could feel my bone. Like I was like, that's a bone. I could also kind of feel where they drilled the holes for the sutures or anchors. A big, really intense pressure on the incision that I could feel, which obviously there's kind of like a fucking knee brace on it, clamping it, if you will. So right now it's 9, so I have 1 hour until I can take they gave me tramadol, those words, tramadol and acetaminophen, and it is a mighty fine painkiller, so I'm going to take that in an hour, and I still have some school to do. I'm gonna share some stuff about my experience in the hospital, because I can. This is my video and you're watching it, so fuck you. Respectfully. All the nurses were super nice and amazing, and it was really nice, actually. Like, it made me feel a lot better. I was sweating so badly, like, so like when they like did questions and everything, right, like the nurse before taking me up to the like OR prep waiting area thing, and her and then the guy that wheeled me up, they were like, isn't she like technically a minor? And they're like, wait, how old are you? I'm like, I'm 18. They're like, well, it's kind of technically a minor, but like also an adult. And then I made a joke, because I can't. It's not illegal, okay? I said, yeah, I'm 18. I'm old enough to be a sex worker, but I'm not old enough to have a credit card. And they laughed, which made me feel kind of good about myself. The guy wheeled me up to the like OR waiting room, and I was just kind of chilling, and then another nurse came, did like she asked me, she was like, do you consent to getting a rapid COVID test? And I was like, okay, why not? But they took a swab, but they didn't jab it into your nose. They kind of just like put it a little bit and did this. And then she came to me later. She's like, you're actually a case 2B. I have no idea what that means. And she's like, I didn't have to do that. But like, you consented to it. I'm like, yeah, I did. It's fine. It's chill. We're good. And then the anesthesiologist came. She was really nice. I had a question for her, and it was, are you allowed to have like a new fresh tattoo and be put under anesthesia? You are, by the way. You are. I really wanted one, but my mom's like, no, you could get canceled again. I'm like, I don't think it would affect, but I also didn't want to risk it, so I didn't. But now I know it's okay. I'll know that for next time. Group 1, 2 doctors introduced, or at least one of them was a doctor. I didn't quite hear what the other one said. It's either a doctor, a student, or a nurse. So, yeah, but one doctor came to introduce himself. He's like, I'm part of Dr. Visconti's team. We're gonna be in there, like me and the other guy. And then they marked my leg. My left leg. I was asked which side of my leg, like 5 times, obviously to make sure that they don't operate on the wrong side. And then I was kind of really flattered because the injury is rare, right, and not common, and then like none of the doctors had seen anything like that before. While I was waiting for my surgeon, Dr. Viscontis, another doctor came, and he's like, Lauren? I'm like, yeah. He's like, you're the one with the knee snapping thing, right? Like, yeah, that's me. He's like, do you mind if I look at it? I'm like, no, go to town. So I showed him the knee snapping thing, and then immediately after I showed him, he's like, wow. And then he went to my other side, grabbed my other leg, and was like, can you make this side do it? Does this side do it too? No, only the one side, unfortunately. And then he's like, sorry for just like grabbing. I'm like, no, it's fine. It's rare. It's cool. I get it. And then Dr. Viscontas, the man, the myth, the guy who fixed my knee, I think, came and I had like a bazillion questions. It was good. It was good. I will be able to do breaststroke again, which I sucked at it, but I don't really care. I want to do it again. I asked, oh, so I have another appointment in March, 6 weeks after. So that he looks at it, does a checkup, sees how it's healing and everything. And then I don't get to do physiotherapy or put any pressure on my leg until I see him in 6 weeks. So pretty much in bed rest and everything. And I'm not allowed to straighten my leg because it puts stress on the sutures or the bone. I think it might be the bone. Right now my knee really hurts because of the brace. Other than that, like, it was pretty chill. Like, I wasn't totally out of it. I did school, so win-win, I guess. And then I asked, what else did I ask? I had like a huge list. The sutures dissolve, and I asked if I got staples or stitches, and he's like, he stitched like on the inside and they dissolve. And then I was like, I'm so excited, the scar's gonna look cool. And he also was like, don't even worry, it's gonna be a small one. I was like, I don't care about the size, make it as big as you need to be, because the scar's gonna look cool as shit, okay? It's gonna look cool as shit. I was wheeled into the operating room. I had to untie my like dress gown thing so that my bare ass was on the operating table. And then I got hooked up to a bunch of machines. I have I don't know if you can see that like circle right there. I have a circle here, there, and on my side, and that was obviously for like vitals and everything, to make sure I didn't like fucking die or whatever. Right here where that little dot is, yeah, that's where the intravenous went, or intravenous thing went for anesthesia. And I don't remember falling asleep. No, like literally, it was amazing. Like, I went to sleep, and the next thing I knew, I woke up and I was in the OR, like, care place. My first question was, did the snapping stop? I was like, excuse me, did the snapping stop? And the nurse was like, I don't know. I didn't write anything. And then Dr. Viscontas came and gave me the rules, and I asked him, did the snapping stop? And he's like, I think so. One of the first things I did was move my foot. It moves. And that was a big thing for me, because I know there's only a 5% chance, because there's a nerve that runs right along it. I think it's the perineal nerve that runs right along like your side, the lateral side of your leg, and it goes all the way down to like bring, obviously, like movement, like it does the motor stuff for your feet, right? So there's like a 5% chance that the nerve could have just went like, that didn't happen. That was one of the first things I did. I was like, foot, it moves. We're golden. And then I talked to Dr. Viscontas, chilled a little bit, and then I went back down into the daycare, like surgical daycare. And then my mom was brought in, she brought me my crutches. They kept me in to do a couple more vitals, and then I was on my merry way. Anyways, so yeah, now I'm there, and we're there, and then on Friday we go back to Nanaimo and stay the night there, and then drive all the way back to, I think, Port Hardy, and then catch the 15-hour ferry ride back home. I get to take my pills in an hour, and I'm so excited because it hurts. Like, it's like an intense pressure. Well, now I know it's because like my mom yanked that shit back on. She just went to fucking I still love my body. Ow, that fucking hurt. I think I'm gonna make this the end of the kind of surgery video, because like next 6 weeks are not gonna look very much different because I'm kind of stuck in a brace for the next 6 weeks until I get the okay and like physiotherapy plan from Dr. Visconti. So I'm gonna like drag you around. It might be like 2-week videos, be like, hey, this is what I did today. Yeah. So Frank is back, bitches, and I love you, and I'll see you guys in the next video.